Audience, Dr. Goldberg, please come forward. We look forward to your testimony in opposition to the legislation. You have 5 minutes, ma'am. Please proceed.
And committee members, thank you very much for the opportunity to speak. I'm Sharon Goldberg. I'm an internal medicine physician. I've practiced medicine for 21 years, and my background is mostly academic, internal medicine, hospital-based, clinical research, and medical education. Wireless radiation has biological effects, period. These effects are seen in all life forms: plants, animals, insects, microbes. In humans, we have clear evidence of cancer now. There is no question. We have evidence of DNA damage, cardiomyopathy, which is the precursor of congestive heart failure, neuropsychiatric effects. 5G is a conversation about unsustainable healthcare expenditures. Why do I say this? We've been sitting on the evidence for EMR and chronic disease for decades. And now we are seeing all these epidemics appearing. So diabetes is the first epidemic. I think most of you know the statistics. They're very scary. 1 in 3 American children will become diabetic in their lifetime, and if they're Hispanic females, the number is 1 in 2. Okay. So what does this have to do with wireless radiation? Wireless radiation and other electromagnetic fields, such as magnetic fields and dirty electricity, have been clearly associated with elevated blood sugar and diabetes. The closer you live to a cell tower, the higher your blood glucose. That is based on hemoglobin A1C measurements. So the idea with small cells of putting the cells closer to people's homes and bedrooms scientifically is very dangerous. And from an economic perspective, it's dangerous. And you may not know this. I was shocked to find this out. But the way you create a model of diabetes in rats in the lab is by exposing them to 2.4 gigahertz. And this is not for long-term exposure. So we need to start measuring how much radiation are people being exposed to. And before we roll out 5G, there are 4 kinds of electromagnetic fields that we know are harmful to human health. So radio frequency radiation, magnetic fields, dirty electricity, and electric fields, okay? Our exposure, any given person, and all humans are affected by EMFs. Our given exposure has nothing to do with the research that my colleagues are going to cite with the National Toxicology Program. That is an assessment of the risk of 1 cell phone in the near field, okay? What is our exposure in a day? It's not 1 cell phone. It's cell phones, it's multiple wireless networks, it's smart meters, it's cell towers. It's this sandwich, and it all adds up. And this is a serious problem for occupational health, public safety, and personal safety. And I feel that it's irresponsible to be even talking about the Internet of Things and rolling out a new untested technology when we're not even measuring what are our current exposures from the current network. I've spent my career taking care of so many patients who were sick in the hospital that when I found out about the links, I was just shocked. I couldn't believe it. So I've read these articles myself, and the experts who don't work for telecom and who are in their independent research, everyone comes to the same conclusion. This is exactly what happened with tobacco. It's the exact same thing. And really, right now, the only people who are able to protect Americans are our legislators, because we don't have any relevant regulatory guidelines to protect human health. The FCC guidelines were developed for short-term exposures, 6 minutes, 30 minutes, depending on it's a phone or an outdoor exposure. And they have absolutely no connection to the biological effects that have been very clearly summarized in the Bio Initiative. That's a huge document. 5G is an untested application of a technology that we know is harmful. We know it from the science. We have decades of evidence to show that it is not safe. Researchers who are funded by private industry, the results of their research are much more likely to support whatever it is that is being funded.